What what can we do? You know, everybody has a role to play. Everyone, whether doctors or non-doctors, as a society, as government, as bodies, the doctor, a doctor, a physician, a resident doctor has himself or herself has a role to play. The departments the doctors work under has a role to have roles to play. The hospitals and institutions they work under have roles to play. Regulatory bodies like the Medical Dental Council of Nigeria, the West African College of Physicians, West African College of Surgeons, the National Postgraduate Medical College has a role to play. Professional associations and bodies like the National Association of Resident Doctors, the Nigerian Medical Association, their pressure groups which they have role to play. The Ministry of Health, national governments, international bodies like the World Health Organization, they have roles to play. I'll start by talking about what a doctor, as a doctor, what should you do? In medicine, when you graduate as a doctor, you're a general practitioner, there are different paths you could take. There is academia, you do masters and you enter the university to teach undergraduate students. There are different aspects of academia. Then there's a part of the medical residency where you enter as a junior resident, senior resident, to qualify as a specialist, as a consultant. There are other choices. There are other paths too, other than this, you know. Then there's the jackpot track, which is also another track that people follow. And we see that in case of Dr. Oluwafemi, he has also told that part. He told the part of medical residency and also JAPA. So in all of this, the doctor should know thyself. As a doctor, know thyself. Know yourself. Know your body. Know what you are capable of. There are specialties that are more demanding. There are others that are not as demanding as others. And so, in making a choice, as we've seen, many of the residents that Oluwafemi, Mike Umo, a house officer, Edigba in Okerogene, Edigba in UBTH, they were in the surgical line, when it happened. So we know surgical specialties are very demanding. Other areas that need surgery like obstetrics can be very demanding and all of that. So you could make a choice of not going into areas that are quite demanding, or if you know you're capable, you can go into the areas that are demanding, because after all, the ones that are more demanding may end giving you more skills that will help you make more money in the future or something like that. Another thing is that we've seen doctors working in multiple hospitals. Some doctors work in 2-3 different hospitals, work in the government hospital. When they close, they go and work in a private hospital and now sleep in another hospital. Some doctors don't sleep at home. They sleep in a private hospital. They work in 3 different hospitals. We've seen doctors who boast of, those days they used to work in 3 hospitals. We've seen that, that work in so many hospitals and all of that. So that can contribute to burnout. They do it to raise more money. Like if you want to jackpot, you need more money. And so some do it to gather money to jackpot, and some do it to meet up and all of that. But if you work in multiple hospitals, you increase the risk of burnout and burnout syndrome, and you increase the risk of problems that could arise from that. And as we've seen, sudden collapse, suicide, and other untoward um, adverse effects of overworking. So let's advise ourselves, you know, and reduce the work that we give ourselves. We've seen doctors spend their annual leave doing locum jobs, meaning that you go on leave once or twice in a year, 30 working day leave. Some will take their 30 working day leave and now go and work in another hospital for the entire 30 days, 30 official working days, so that you make more money. If you do that and you don't take time to rest, you increase the risk of burnout and the adverse effects that come with that. We've seen doctors that collect sick leave, excuse without proper checkup. Some doctors will come to the general patient, to staff clinic, and they tell you they are sick and all that, and that they need a sick leave. Yes, they're entitled to sick leave. Yes, they should be given sick leave. Doctors who are sick should be given sick leave. But more importantly, there should be proper medical check. Even though you are a doctor, you are sick, seek the attention of another doctor. Be seen by another doctor. You will not be objective. If you are treating yourself, you're self-medicating, you may not be too objective in assessing what the problem is and seeing what really needs to be done. If you are sick, it should be an opportunity for you to seek medical care, for you to have proper evaluation, and you to do proper investigations to know what is going on. So don't just collect sick leave, but take that opportunity to seek proper care. Doctors self-medicating and minimizing symptoms, this can happen. And so it is good, even as a doctor, for you have staff clinics, you have the staff clinic are there, the NHIA, National Health Insurance clinics are there, where you could go for proper checkup and proper evaluations should be done to reduce self-medication and reduce minimizing symptoms, which may turn out to be leading to more serious diagnosis. Then some also engage in extracurricular engagements, too much responsibilities. Doctors, they play an active role in their community. They are leaders in their community. They are leaders in religious organizations. They are leaders in philanthropic organizations, non-governmental organizations, and all that. They are very active in a lot of functions and all that. It will be wise for you to look at the number of responsibilities you take upon yourself, considering that you already spend many hours at work already. So taking on too many extra responsibilities from other places could add to the burnout syndrome that we've talked about. The 2017 revision of the Declaration of Geneva, which was adopted at the 68th World Medical Association General Assembly in Chicago, USA, October 2017, says, I will attend to my health, well-being, and abilities in order to provide care of the highest standard. In the oath that has been taken by doctors now, the latest version in 2017, it includes, as a doctor, I will attend to my health, well-being, and abilities in order to provide care of the highest standard. I will take care of myself so that I can take care of others. Apart from the doctors, departments have a role to play. We've mentioned some of the departments, including surgery, emergency care, obstetrics, There is need for departments when you have unfortunate incidents like what has happened to Dr. Femi. It's an opportunity for introspection, for departments to look at their schedule, to look at their roster. We saw what happened with Dr. Audu in orthopedic hospital Lokoja, and we saw how after the outcry adjustments were made. So that too can also be done. Review rosters. Departments should make mandatory off days. Like in the US, they said in a week there should be one off day. So mandatory off days should be implemented. Mandatory annual leave. It shouldn't be optional that okay, if you like to go on annual leave. No, mandatory annual leave. You take your annual leave, it should be mandatory. Mandatory medical checkups. So departments can institute certain regulations to help the doctors working under them, for them to have time of rest, and for them to seek mandatory medical checkups should be implemented. At the level of the hospitals and institutions, employment, we know that the more hands you employ to work in the hospital, the better the working experience for the doctors and other healthcare workers that are working. So employing more hands to help will also help. The hospital and institution can also help review what did each departments under it, they are also what they are also doing. In terms of employment, it's also important that when you employ staff, there should be pre-employment screening. The purpose of the pre-employment screening is not to stop some from working. It's not to say, no, you can't work. No. The purpose should be that at the point of employment, it should be an opportunity for there to be a comprehensive evaluation of the person that is coming to work in the hospital. Some persons already have pre-existing condition, pre-existing heart condition, pre-existing conditions, which should be noted, and the person cannot be guided. For example, somebody comes with a condition, and so let's say the person is already hypertensive, have uncontrolled hypertension, for example, which the person can receive treatment and can get better. The person could also be advised, if let's say if the person is choosing a specialty that is high stress, which could also contribute to worsening health condition, the person could be advised to make a different choice. Those are some of the options. Then if the person stays on that same track, the person should be advised to always seek regular medical checkups to optimize his health as he works in that high stress environment. So that should be done. It shouldn't be that you just employ people and you just take them in without check. The purpose of the check, as I've said, is not to victimize anybody, not to punish anybody, but to make them realize that, oh, it's not because of litigation, workplace litigation. No, it's because you want to give the best to those working under you, and to give the best care to those working under you, to make sure that those who you can pick up certain things early and it can be managed early. Then there are roles that should be played by regulatory bodies. The Medical Dental Council of Nigeria, which is responsible for regulating medical schools, regulating the practice of medicine and dentistry in Nigeria. They have a role to play where they can play a regulatory function to make sure that work hours are looked into, and things that will improve the welfare of doctors can be looked into. For the medical residency training, this one is under, you have the National Postgraduate Medical College of Nigeria, you have the West African College of Physicians, and the West African College of Surgeons. So these bodies can also look at the medical residency training, just as it was done in New York, the Libby-Zion law, and later adopted by the Accreditation Council of Graduate Medical Education in the US. These postgraduate bodies in Nigeria and West Africa can look into these programs and see how things can be adjusted, Instead of just following the hustler model, just the way it was, and follow tradition, some adjustment can be made based on modern realities, and instead of just giving condolences and expressing sorrowful messages when things happen, things can be done to improve the welfare and the condition of physicians and resident doctors. Then we have associations and professional bodies. We have the National Association of Resident Doctors, Nigerian Medical Association. There are pressure groups that can also do something, or have different associations, like different faculties, have different associations, obstetrics and gynecology have their own, you know, and other associations. This can also try to put in measures to help as well. The Ministry of Health is all these agencies and body, and other the Ministry of Health, they can come out with policies and regulations that will help in the promoting the welfare, not just concerned about the well-being of. It's important to care about the well-being of the patients, the well-being of the population, the health statistics of the population, but it's also important to care about those who are caring for others. So if the health, the well-being, the welfare of the health of health givers, caregivers are improved, they also improve the level of care they give to others. Then we have at the level of the national government, policies can also be put in place. Employment, employing more hands will help improving the welfare of doctors and healthcare workers will help. Another thing, policies should be put in place, train more people to do more. Where you have other cadre of staff, apart from doctors, nurses, midwives, community health extension workers, and all that, they can also be trained to do more, such that it will lighten the burden that is on doctors and physicians. Then we have international bodies like the World Health Organization, United Nations, World Medical Association. They could also, put in place policies, give recommendations to national, subnational bodies to use, you know. More than that, as a society, we also have a role to play. What do I mean by this? Oftentimes we hear, if a doctor says I'm sick, people will say, doctor, they sick. This Iron Man mentality, superhuman mentality that has been attributed to doctors. The doctors are very strong, they can be able to cope whatever stress they are faced with. Doctor, they sick. It's a common refrain. That expectation that as a doctor you could take care of yourself, you don't need you shouldn't be getting ill and all of that, which is a misconception. Doctors are humans, they can get ill, they can get sick, some collapse, and some could die in the course of their job. They are humans. You should note that doctors can get ill, and as such we should show due regard and consideration. They can get ill, so they can get ill, they will need care, and so show consideration. If you go to a hospital and you have, the hospital have few doctors, and you see that there is a doctor that has been working for long hours and he has taken some time to rest, show some understanding. Show some understanding. I've also worked in a hospital where we had few hands in the past, and there was a time that I was the only one residing within the hospital, others resided outside. So the implication of that, since I was the only one residing within the hospital, they can always come and knock at my door. I remember when once I was very tired, I'd closed from work, I went to rest. I just stepped in to rest. They came to knock my door. There's a patient and all that. So I told the person, please, I'm tired. I need to rest. Person said, doctor was trying to urge me to come and see the patient. So I told him, you know, but you know, be firewood, I need to rest. So he was now physically obstructing the entrance. I couldn't close the door because he was physically obstructing it. So I told him that, see, I could only be useful to the patient if me I have health. I told him, you either you leave this door now, leave this door and go and tell the person wait, let me rest a bit and all of that. So such situation, people should show understanding. Where there are few hands in that unit, in that hospital, and you as a patient relation, show some understanding. There are not many doctors in that hospital, and you come and you know that the doctors have been working from morning till that point, and the doctor has they tell you that the doctor has gone to rest or something. If it's not an emergency, something that can wait a bit, you show some consideration. you know More cadre of staff, as I've said, need to be trained, and so we should show understanding that if you get to a hospital, the doctor is not there, there's a nurse there. If the nurses and other people are well trained and of course they are well trained, but if they are being allowed to take on more responsibilities, like you see it in some state hospitals and general hospitals, you see nurses taking more responsibility. In the labor room, for example, you have midwife and nurses who take deliveries. They don't wait for the doctors to come. They only call the doctor when there are difficult deliveries, when there are some challenges that require the intervention of the doctor. They take the deliveries, in some cases repair episiotomy and do a number of things, in the absence of the doctor, because they are trained to do so and because they are allowed to do so. But we have this situation in bigger hospitals where they say, oh, this thing must only be done by doctors, this one will only be done by doctors, this and that. So what do you have is a situation whereby the nurses that are working in that situation would not be able to have certain skills, not because they didn't have the training to do it, but because they are not being allowed to do it. And so they don't have the skills. Is something that you have to be doing all the time for you to have a mastery of it. If you stayed a long time without doing it, then you lose it. And so if you now have them doing more things, then you now have the situation by the overburdened doctors could have some time, to rest and be able to focus on more challenging cases. You know, so there are huge expectations from doctors to society. People think that doctors are rich, which isn't true. If in any town or society, say in the area where you live, in the town you live, if you count the richest 100 people, you may find few doctors there. You know, the concept that doctors are rich, wealthy, and all that is a wrong concept. The way our system is now, people who are into business make a lot of money. People who are into contracts, even those who are into politics and all of that. So when there are huge expectations, doctors supposed to have certain social standing, to live a certain lifestyle, that is maybe bigger than what he could afford and all of that. So you have pressure on doctors to validate the expectations that people have and to overdo things in order to meet up with the expectations. So we all have a role to play. We show understanding and we have realistic expectations and say these people are humans, there are limits to what they can do. And where we can show understanding, let's show understanding. Where the system can allow for more people to do more, the more responsibilities you entrust on more cadre of staff, the better they are able to work. It's not about pay disparity or stuff like that. It's about having more people do more, and you now have more people taking care of the burgeoning population. We have a huge population in Nigeria that is expanding, and it's not realistic that there can be enough physicians or doctors trained on ground to cover for the population. And so adjustment have to be made to take cognizance of what we have. The society has a role to play. So on a final note, I want to read the Declaration of Geneva 2017 in full. This is the physician's pledge, the physician's oath, the Hippocratic oath that has been designed, reviewed. This one was adopted, 2017 revision was adopted by the 68th General Assembly of the World Medical Association, Chicago, US, October 2017. The Physician's Pledge. As a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit considerations of age, disease, or disability, creed, ethnic origin, gender, nationality, political affiliations, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me, even after the patient has died. I will practice my profession with conscience and dignity, and in accordance with good medical practice. I will foster the honor and noble traditions of the medical profession. I will give to my teachers, colleagues, and students the respect and gratitude that is their due. I will share my medical knowledge for the benefit of the patient and the advancement of healthcare. I will attend to my own health, well-being, and abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threats. I make these promises solemnly, freely, and upon my honor.